in Croakey here at the Choosing Wisely conference in Melbourne, and I've gathered together some of the key consumer reps here for our own mini panel. So if you could just introduce yourselves, please.
Hello, I'm Jennie Parham and I'm doing some work currently with the Consumer Health Forum of Australia.
Richard Osborne from Deakin University, Professor of Public Health.
Thank you.
Leanne Wells, Chief Executive of Consumer Health Forum of Australia.
And a very constant Croakey friend and Periscope person. Now, the consumer focus has been quite strong to my mind at the conference. What do you think? What have you taken from it? How do you think it's looking, and what are the directions? Can I throw them at you like that? Who wants to go first?
Oh, well, I'll go first. I mean, look, the comment that really resonated for me was the Chief Medical Officer's comment on the panel this morning about a consumer and community activation and engagement strategy, whatever you want to call it, is really the next big step that Choosing Wisely needs to make. And it is about a social change and a movement and a conversation that's really bottom-up driven. So I think that's really exciting. And I think the other opportunity we've got is to do what I call getting beyond brochures. If we really want the 5 questions to ask your doctor taken up and translated into change, about a change in the way doctors talk with patients, patients talk with doctors, the way communities think about self-management and health literacy, then we've got to get beyond the brochure, and we've got to really look at a smart strategy, and we're looking forward to designing that with Choosing Wisely and experts like Richard.
And did you see some of those ways ahead in the examples that were given today on?
Oh, look, I think we saw snippets of that, but I think we really do need to sit down with experts like Richard, who really, he's a well-renowned expert in health literacy. We need to sit down with some primary health network vanguard sites that we want to work with. We want to sit down with some consumer advocates who have been involved with Choosing Wisely up until this point, because they've got deep insights and advice of their own to offer, and we want to work with people who've got some experience driving change movements. I think if we can bring all that expertise to the melting pot, then as Rob and Linda said, we've really got an opportunity to design something that's very bespoke to Australia and innovative to Australia as well. We don't want to just blindly follow what North America have done.
Right, thank you. Now, Richard, your world expertise on that, and it goes from South Africa to the UK and back home. What can you offer this, and what do you think are the priorities?
One of the very impressive things with this meeting is the number of impressive people, really, who are in leadership positions, who work with consumers every day, or are consumer groups themselves. So the right mix is here for the right sort of innovation. What's required now is to generate new ideas that will work in the hearts and minds of the ordinary consumer.
Can you give us a couple of examples of those things that do work but tend not to be put in use, or indeed those that are?
Well, one of the most extraordinary things is Teach Back, and we actually have clinicians supported and trained to just check with the consumer. So can you, I just need to check that I've explained things correctly. So what will you do when you go home? And what the consumer then is able to say back to the clinician gives them a very good idea of how good their job was in communicating. And it's a very important way which we need to incorporate into all healthcare, really. And that's about health literacy. So there's 2 things here. One is the health literacy responsibility of that clinician and the organisation they're working. So irrespective of how strong or weak or the health literacy of the consumer is, that the organisation responds to them at their level in a sensible sort of way. But this movement here is also about enablement or activation of consumers. We want the consumers to have the best chance to ask questions, to get their needs met. But of course there's some consumers who don't really want to ask questions, and just going to see a healthcare professional is tremendously scary. So we really need very authorising environments that in their family it's talked about. It's okay to ask the doctor a question, you're supposed to. And when they go into the healthcare setting, they feel very comfortable in asking questions, and they know that their needs should be met and will want to be met by the healthcare professionals. So there's this harmony between what is the consumer's needs, irrespective of their health literacy or their socioeconomic status, and what the healthcare system has to offer. And of course, we want the healthcare system to offer the right care and the right range of treatments, and with withhold demands for ineffective treatments or treatments that won't alter clinical decisions.
So all that sounds very sensible. Is it just the next thing to come, or are there barriers to stopping it?
The next thing to come is to really have interventions at many levels, at the very micro level within families, through to interactions between the individual and the healthcare professional, how healthcare professionals have to do things differently on a daily basis, what has to happen in different towns or villages to support people to be able to be safe to answer questions or ask questions, and then of course the policies and structures around making all that happen. So the daily life of the consumer isn't going to change much unless things are different in their family, in their community, and the system around them. So things will need to be very different, but they can be very different in different contexts, because what's happening in far north Queensland can be very different here in metropolitan Melbourne. So there's had to be a lot of very different interventions in very different parts of the system, and some are quick and easy, like teach back and patient-centred care elements, but others, structural changes and cultural changes within the healthcare professional system, will take time. But we need leaders out there within the community, within consumers, but leaders within the healthcare system as well, to take the stand that we're not going to stand for inappropriate care, inadequate care, or improper communication. We need to have a real feeling of this is just not good enough for Australia, for our so-called equitable healthcare system.
Now forgive us, we're struggling against Debbie Harry, I think all blondie here on this. Not you. Jennie, can you just tell me what your takeaways from this
Look, I sort of concur with Leanne. I mean, I was really struck by the term civic or a social movement, and the real, to me that puts it up to another level. We're not just talking about a strategy, we're actually looking at a movement of cultural change where we're really going to need to develop some, which needs to be consumer-led. You can't have consumer engagement without being consumer-led. So we're going to need to develop and empower consumer champions to really, really create a really strong movement.
Fantastic. Thank you very much, I think.